Hello and welcome. My name is Alana Gordon. I'm a reporter at The World covering global health. This is a Facebook Live Q&A about the coronavirus pandemic, airborne transmission, ventilation, and school and workplace reopenings. And backed by popular demand is Joseph Allen, director of the Healthy Buildings Program and associate professor of exposure assessment science in the Department of Environmental Health at Harvard's T.H. Chan School of Public Health. Thank you so much for joining us.
Good to be back with you, Alana.
And so you can post your questions for us on Facebook at at Forum HSPH, or you can email them to theforum@hsph.harvard.edu. This Q&A is jointly presented by the Forum at Harvard's T.H. Chan School of Public Health and The World from PRX and GBH. So we are going to get into so much about ventilation, circulation, air circulation, schools and buildings. But first, let's start off with an experiment to kick off this discussion. So I want to throw it to you as we begin, a timed experiment during this Facebook Live.
Yeah, so it's great to be back with you. And we thought we would have this conversation about ventilation. I wanted to give a little show and tell about what's actually happening in our homes and actually all of our buildings and schools. And one way that we can make the invisible visible is by measuring carbon dioxide concentrations as a proxy for ventilation. So what I have here is a little carbon dioxide monitor, and that's 1722. That's how many parts per million of CO2. So that's quite high. You want it under 1,000 parts per million. So I know my room is underventilated right now. Now I have my windows closed, door closed. So what we'll do is there's just a little experiment here. I'm going to leave this here. I'll prop up my windows a little bit. I'll open the door, get some cross breeze. I'll be back in 1 second, and then we can continue the conversation.
That sounds great. And so part of the reason that we're having this conversation right now, as Joe is opening his doors, is that we are getting closer to vaccines right now. But the reality is the United States is in the grip of a coronavirus surge that by many measures is the worst yet, with deaths and hospitalizations and new cases topping records from the spring and summer. And so, okay, so the windows are open, the door is open. Yes, correct?
We're good.
Okay, so in continuing, how I wanted to set up this conversation as well is about, we're in the midst of the surge, and you recently stated that the CDC has taken on ventilation. They've updated their guidelines, and it's what you've been waiting for, and reads exactly with what you've been trying to get out there since February, which is increase ventilation, filtration, and supplement this. And there's so many different ways to do it. And I wonder if you can just break down what you mean by this and what these new CDC guidelines mean.
Yeah, it's really quite an important update as we see CDC start to become unmuzzled a bit here. Myself and others have been urging CDC, World Health Organization, and others to recognize that airborne transmission is happening. So first, we have to recognize the modes of transmission before it makes sense as to why we're trying to do things like open up our windows. So we know close contact matters for transmission. Airborne transmission matters. We can talk about how we know that and why. There's a little bit of contribution from fomite or contaminated surfaces, but not much. I know we'll talk about that. But so this airborne transmission is happening. And that means we talk about airborne, we're talking about far field airborne transmission. That means transmission indoors, within the same room, beyond 6 feet. And so as we talk or breathe, sing, we're emitting these particles that will actually stay aloft for 30 minutes, an hour or more, until they're removed through one of two ways. They're diluted out of the air through ventilation, or they're cleaned out of the air through filtration. So this is why we have some of these controls in buildings that I was writing about and have been writing about for a long time, which is in this order. You want to increase the amount of fresh air coming into your school, home, or office. 2, put in better filters on the recirculated air, specifically a MERV 13 filter or better. And 3, you can supplement that with the use of portable air cleaners with a HEPA filter. Now, why I'm so excited that CDC said this, because they've ignored it for many months, but really last week, maybe it was earlier in this week, they posted a full page dedicated to ventilation, and it is exactly what we've been talking about since March. It's technically correct. Even they get the nuance right. They have some examples there. And that's really a big turning point, because it's no longer the case you just say, well, I heard Joe say we should do this. You can point to CDC and say, see, this is now official guidance. Everything we've been saying is what you need to do. So that's a little bit, how we're exposed and then why buildings can intervene on that.
It seems kind of daunting, though, to think that there are these particles in the air that can be there for a long time. I imagine that they might become weaker in their ability to infect somebody. So, how do you make sense of that and how the air that we breathe when we're inside, especially like, for example, in the Northeast as it gets colder?
Yeah, I mean, you think about it's really about shared air. So whose air are you breathing? I'm alone in my office right now, so there's no risk, even if I was asymptomatic and infectious. But the particles, distance still does matter. So if you and I were really close having this conversation at 3 feet, you would breathe in less at 6 feet and less if you were across the room. An analogy we actually talked about last time, I think is one of the most effective, is to think as if it's smoking, right? And smoke particles. So if I was smoking 3 feet from you, it would be noxious. It'd be right in your face. 6 feet, a little bit less. Across the room, you would smell it depending on the size of the room, the volume of the room, and how well it was ventilated or cleaned. You could be across the room and not notice I was smoking if that room was really well ventilated. And so we can think about respiratory particles the same way. They actually move through the air in a lot of the same way, in the exact same ways, and they're cleaned out of the air in the same ways. So it's a really helpful visual if you thought about it. You can't see or smell someone's breath for the most part beyond a certain distance, but you can think about them smoking, and it really puts that in perspective about distance, time, volume, and ventilation.
What have we learned? I mean, because so much of this virus, has been a continuum of learning. And I wonder from around the world, what is it that we've learned about this virus and its risk when it comes to, uh, spreading, for example, through the air? There was just a case study from South Korea about two people 20 feet away for 5 minutes in a restaurant, and they found that it was a related exposure. That's one example. I wonder if you can talk about that and about, what we've learned from around the world.
Yeah, we've learned a lot. In fact, I think there are no more mysteries. I mean, there are plenty of mysteries with this virus, but no more mysteries in what needs to be done indoors to keep us safe. So you gave that example of that restaurant study. It's been all over social media and the news this week. People at a restaurant transmitted clear transmission beyond this magical 6-foot buffer. But if you look at all of the high profile case studies that I think many people be familiar with now, outbreak at a choir practice, on a cruise ship, at a salon, ice hockey, on a school bus, it doesn't really matter where it was. It's the underlying factors, and they're actually all the same. It's time indoors, no masks, and low to no ventilation. So this latest outbreak is exactly that. No masks, they were in a restaurant. There was low to no ventilation, just recirculated air with no filtration. And so it's really not surprising anymore when we see transmission happening indoors when those conditions are present. Now, really interesting, we don't have a case study, to my knowledge, where those controls have been in place. Right? We don't have a case where it says people were in some place indoors wearing masks with good ventilation and we saw an outbreak. We just haven't seen it. So we know this is a major way this virus is spread. And importantly, we also know what to do about it and how
Can
to
you
control that.
clarify the difference between circulation and ventilation? Because I'm also thinking about recommendations like, oh, I'll put a fan in the room and that will increase ventilation or circulation. Can that be harmful then? Can you clarify circulation versus ventilation?
Yeah, it's a really good question. So you think about ventilation. Let's take a building with central air system, right? Some fraction of outdoor air is brought into the building, but to save energy in most buildings, about 80% of that air is recirculated, right? You don't have to heat and cool that air. So you have fresh outdoor coming in, that's outdoor air ventilation. And then you have a total flow of air that includes some contribution from outdoors and some that's recirculated. Now, if it's purely recirculating only with no filtration, well, then you're going to have a buildup of anything that's indoors, gases, respiratory particles, viruses. But if that recirculated air goes through a high efficiency filter, well, then you're delivering clean air, clean from virus. So this is why it's any combination of more outdoor air, because that dilutes what's indoors, or even if you had everything closed up in here, but I had a portable air cleaner with a HEPA filter running in my office. My CO2 might still stay high, but I'm cleaning all of that air. So from a disease standpoint, it's still pretty good. Now, a fan by itself isn't going to do anything. It's just moving the air around. And you have the risk, and sometimes you put a fan in it blowing across me, say you're sitting next to me, you might be blowing my air right into you. So that's not ideal either. So that's how you can think about kind of this ventilation, filtration question.
You've talked about some ways to improve ventilation, but what are the biggest obstacles? What are the biggest challenges for workplaces, for buildings to do this?
Biggest one is that our standards that were set in the 70s in response to the energy crisis have forced on us a minimum standard of outdoor air in all of our buildings. It's called the standard for acceptable indoor air quality. Acceptable, right? So acceptable is objectively not acceptable right now. And so a lot of buildings are finding themselves in this space. Well, I was designed for this low standard that we know isn't protective against infectious disease. How do I go over and above it? So sometimes the systems cannot handle higher outdoor airflow. Or in the Northeast, for example, when it gets really cold in the winter, it's hard to condition all of that air. So you can, in most cases, put in a better filter on the recirculated air. Third, there's always something you can do, right? And third would be to supplement that with these portable air cleaners, even industrial size ones that have a HEPA filter. So that can increase the total number of air changes per hour of clean air, this time going through a filter rather than air changes from outdoor. So those are some. I said the other one is perceived cost. Well, it's cost. Well, I have to run my fans harder. It's going to cost more money. That's an issue, and I understand it. But right now, in the middle of a pandemic, trying to get, let's say, kids back to school, that's worth the extra cost right now.
Let's talk about schools. You've been critical of schools closing. So why do you think that schools should stay open for in-person teaching? And what can be done to reduce the risk of spread? And what's the latest evidence on the role even of schools in this?
Yeah, this is nothing short of a national emergency. Tens of millions of kids are out of school. And we predicted and knew this early on, that this would lead to, and we saw this, virtual dropouts. In fact, Boston, where I am, 10,000 students missed school in May, just unaccounted for. 60 Minutes had a report a couple of weeks ago, 240,000 students missing, just we don't know where they are. We know they're at a higher risk for exploitation, abuse. In fact, you hear some reports saying, well, teachers, this is one of the key ways we detect things and problems that might be happening at home for some kids. And so we're losing this contact. Recent data is showing that we're seeing decreases in literacy gains for the youngest learners. We see a greater percentage of students failing, and this is happening everywhere. It's not in one pocket. This is in LA, it's in Texas, Minnesota, DC. These reports are rolling in. They'll continue to roll in for the next coming months and years. And importantly, we know how to keep teachers and kids safe in buildings. So my team wrote a 60-page report in June on risk reduction strategies, and we just re-updated it just 2 weeks ago. We put out guidance on 5 steps on how to assess ventilation in your classroom. So we've been pushing out the tools to help schools make their schools pandemic resilient, right? To decrease risk for everybody in the school. And it can be done. And a lot of districts are actually doing this.
Like what?
And yeah, sorry.
Like what?
They're doing exactly what we're talking about. It's the basics here. So number one, most important, is mask wearing. We're talking a lot about ventilation and filtration, but that's controlling it after it escapes. But think about universal masking for a second, right? And that's source control. So if we have 2 masks, or everyone's wearing a mask, and they're 70% efficient, and let's say 100 particles I emit, well, my mask captures 70, 30 enter space. That 30 hits your mask, which also removes 70%. Only 9 get through. So the universal masking is over 90% removal of these particles. Then the space in between the masks is what we're doing with ventilation and filtration, right? Cleaning this. And distance also reduces what hits your mask. But right off the bat, even if the masks were here, it's 90% removal. So it's absolutely key, universal masking. Then these ventilation and filtration. Get your school up to 4 to 6 air changes per hour. Now, my home, the one I just showed you, the monitor, a typical home anywhere in the US gets about half an air change per hour. It takes 2 hours for the full volume of air in your house to breathe. And in a school, typical, it's about less than 3. And we want 4 to 6. So that's a lot of air coming in. That means anytime someone emits something that gets between the masks is diluted out quickly. If they do these things, it can really help reduce risk for everybody.
This might be a question pertaining to workplaces too, but also for schools. What do you do during lunchtime?
Yeah, this is where it gets tricky. So same thing, we have to be really careful when it's times when masks are off, because the emission rate can be higher. I think that's pretty obvious. I've heard great strategies, for example, where teachers, because they're at higher risk than kids, we get a benefit with kids, right? They're really quite low risk for severe disease if they catch this, thankfully. Teachers should stay further removed. I know teachers that pop open a window and stand next to it, even when it's cold. It's a time, it keeps saying we need to get comfortable being uncomfortable this winter. Hats on, coats on, and extra distance between the kids, because masks are not, you don't have the mask on. Second, I think it's really important, and I know teachers laugh when I say this, and I get it, but it's not, lunch is not just a mask break for an hour. When you're not actively eating or drinking, the mask should go back on. And also, if you can make it a quieter time, if it's lunch in the classroom, less talking, right? That's lower emission rate. But really, if the kid's done eating, masks go back up before they have that conversation and move on to the next thing.
There are a lot of questions coming in, and so I want to thank everybody for your questions. I am seeing them and getting to them. This question comes from Vic. Okay, so portable HEPA units can cover a lot of these gaps where schools can afford them, but many don't have the funding to obtain enough HEPA units. Can you address low-cost means of providing air filtration in these situations? And I know you're talking about masking being really important, but what else? And I know you also have looked at kind of the resources that have gone into surface disinfecting, and maybe that's connected to this.
Yeah, it sure is. So it's a really good question. Some of these air cleaners cost a couple $100, and many schools don't have the resources to do that. But if you get one in your classroom, it can solve a lot of the problems with, say, an outdated mechanical system. It can get us through the next hard months here of the winter. There are many districts that have actually went out and purchased these in bulk and gotten better prices. Boston Public Schools, I've been advising them. They just went out and bought many of these. Are going to be, I think, in every single classroom going forward. So it is a really helpful strategy and relatively low cost when we think about the costs of kids being out of school. That said, also, if you have a mechanical system, you want to increase to MERV 13 filters on the recirculated air, that's a couple dollars, really, a couple dollars. These are not expensive filters. The simplest, lowest cost strategy is prop open your windows. And it really is that simple. It's boring. It's like, but it's really simple and it works. Now, some of the resources where you could conserve some money, and thanks for flagging this. I wrote an op-ed this morning in the Washington Post highlighting that we are over cleaning our surfaces. Fomite transmission, fomite being a contaminated surface, any inanimate object that can harbor the virus, like a doorknob. And we're spending, and schools are spending, a massive amount of money addressing something that is not leading to transmission. Or if it is, it's very little and very rare.
Are you saying that hand washing isn't important?
Absolutely not. So thanks. We should continue to hand washing. And actually, that's the key point, is if you think about the logic of surface cleaning, you have to clean every surface as soon as it's touched if you really want to break the chain. The simple way to break that chain of transmission is at the person's frequent hand washing or hand sanitizer. And for schools, we recommend that, right? Every time somebody comes into the school, they wash. Every time in the classroom, hand wash or sanitizer. Every time they leave. That's the most effective way to break this. So hand washing is absolutely key. It's just the overuse of chemicals and trying to clean every single surface all day and every day is just not effective. And that money would be better spent on fixing the air handling systems or coming up with these solutions to address portable air cleaners.
3 feet, 6 feet in schools, or more or less? Because the way that we started off this conversation, I want to get as far away from a human as I can in a room or a space, which may not be practical, isn't practical, but also, yeah.
Yeah, well, we wrote an opinion on this very recently. It's Dr. Sarah Bleich and I. Dr. Sarah Bleich, another professor at the Harvard School of Public Health here, because the 6 foot limit has become one of the key constraints, or one of the key factors that's limiting kids getting back into school because of space constraints. And because the costs are so severe, and because a room full of kids with one adult is very different than many adults, because they're, especially the younger kids, less likely to transmit. And because
Can you just update what we know about kids being less likely to transmit?
Sure. So maybe we'll take it at 3 levels. First, less likely to get it. It looks like kids are less likely to get it than adults. That's really great. If they do get it, they're less likely to die. And that is by a lot, right? It's on the order of, 1 to 2 or 3 per 100,000. So, and actually, if you look at CDC's excess mortality for this year, for those under 25, it's 2% lower mortality this year than the past several years. So the young, the kids are going to be okay. And then on that transmission question, it's clear that the younger kids transmit less or less likely to transmit. I'd say the evidence is more mixed for teens. And all of these are joint probabilities. But what's happened with the distancing has gotten so strict, and it's not taken into account in the context of other controls. So remember, we first started talking about distancing in February, March. That's before masking. Well, now with masking and ventilation controls, which have to be in place, the distancing should not be the factor that keeps kids out of schools. Adults should stay distance from each other, 6 feet or more, and distance from the kids, but the kids can be closer. And now a lot of that comes, think about healthcare too, where they've driven down risk through the basics: masking, hand washing. They take very good care of their buildings with ventilation and filtration, and they can't distance. They don't in a hospital. So if all these other controls are in place, then we feel that the 3 foot distancing, 6 foot distancing should not be what's keeping kids out of the classroom, particularly young learners.
I just want to say we are going to run over a little bit because we are getting some great questions, and I want to keep going forward in this conversation. Thank you. So then what about daycares and kids who aren't going to be masked?
So everyone should be masked over, except CDC is recommending, except for those under 2. So in these cases, yeah, these are the places where these younger kids are less likely to transmit. And so that evidence is quite clear. I would say, though, in these places, this is where we have to pay attention to this control strategy that, I've been talking about it a lot. I think you've been asking a lot. I think fewer people think about this opening windows or ventilation as part of their, set of core things they need to be doing. Oh, I got distance, got a hand wash. Yep. Got to wear my mask. And it's like these other things are really quite important, the healthy building strategies.
This question's from Larry. Is it generally assumed that airborne transmission is almost non-existent when you are outside and wearing a mask? Is that correct?
Yeah, great question. Absolutely. And we could think about the physics here, the fundamentals. You're outside, you have essentially unlimited dilution and a breeze. So you're taking out that ventilation problem. There's no buildup. Now, some distance is good. Wearing a mask, I would say wear a mask when you're outside to come near others. And so the risk is really quite low. And this is why we pushed back on, California recently said, well, playgrounds are going to be off limits. It just doesn't make sense, right? It's outside, low risk. These are the kind of activities we should be encouraging. Everyone get outside. And if you're near others, wear a mask. And that's a really low risk scenario.
This question's from Michael, kind of building on that. And it also gets into this question about what we mean by airborne versus droplet transmission. At this point, he writes, I believe the general consensus is that large respiratory droplets are the primary means of transmission. And this can be mitigated by distancing, as we've been saying, and masking, as you've been reiterating. Do we have an idea or hypothesis as to what percentage of cases this transmission pathway makes up versus the small aerosols that can travel farther and require mitigation through increased ventilation?
Yeah, so it's a good question. And there's a lot of misunderstanding. It actually goes back to decades old, really wrong information in medical textbooks. There's no other way to say it, in our understanding of droplets and smaller aerosols. So let's put some numbers on this. And by the way, CDC's new webpage finally gets this right, and they hadn't got it right in a while. But as you emit particles of different sizes, the size, that fraction of 100 microns, are the droplets that will settle out, and distance protects you. Less than that, especially the part we're most concerned, that you breathe in deep, the 1 to 10 microns, these will go beyond 6 feet. In fact, they'll travel across any room at typical indoor air speeds. And they still stay aloft for a long time, and they'll accumulate. So the ratio of what's happening close versus far depends on what's happening in the room. Mm-hmm. Now, even at close distance, some will be from droplet risk, but also you're emitting fine aerosols close up. So, it's the small aerosols are also important at close. This is like the smoking analogy. There'll be a burst of a cloud here that then spreads out as you go out in the room. Now, to put some numbers on it, my team used the Diamond Princess cruise ship to model that outbreak, a really controlled space. We knew a lot about people's movements and activities, and we estimate aerosol contribution, the fine aerosols, could be 70 or 80% close and far, right? With far field accounting for about 40% of that. So, and for me, from a practical standpoint, I think these scientific questions are interesting. Well, what fraction is what? But also right now for the pandemic, it doesn't really matter, because we know that you have to wear a mask to stop both, and ventilation and filtration matter. So it's like, we'll work at this answer out over the coming months and years, the scientific community, but for the general public, doesn't quite matter. We know what controls stop both.
This question comes from Shelley. I thank you for putting this question in because it's very specific, and I think sometimes the specifics can help us better understand some of the real world situations we're confronting. My elderly friend with pancreatic cancer spent 2 hours at a department store. She says it was very safe. She socially distanced from shoppers. My reply was she knew nothing about the store's ventilation system. So the question is, what is true and not true about shopping in stores, businesses, ventilation systems? And I would add on to that, how do you figure that out, and what's a way to navigate it?
It's really hard because you can't really sense it unless it's really bad, and people describe it as it's stuffy or stale, or you smell even odors from people, bioeffluents, right? That's kind of your only sense. But it really depends on the space. So if it's most department stores and retail are meeting that minimum standard for ventilation, and if they haven't gone over and above, which you won't know, the other way to control that is through de-densification. So if there are fewer people in the space, that would be a tip off that on a per person basis, there might be enough airflow in there. And then so if you're keeping distance from other adults, you're wearing a mask, and it doesn't look like a crowded space, by code, they should be meeting that minimum level of ventilation. And because let's say it's 25% full, the per person or the amount of air per person coming in should still be sufficient. So it's really the only way you can gauge it. It's that feel. Is it overcrowded in here? Everyone has to have a mask on, absolutely. And then is there enough space to keep distanced?
This question is apparently from one of your colleagues, Jack at Harvard, Chan. Is there any evidence for transmission to another room via mechanical air systems?
Hi, Jack. I know exactly who this is, my mentor and friend for a long time. No, so far we have no evidence of between room transmission. Now for things like infectious diseases like measles, we have evidence for that are really transmissible only through the air. And that's why in my opening comment, I was really clear to define what I meant by, airborne transmission: far field, so beyond 6 feet, within room. So within room, far field, but we don't have evidence of transmission through mechanical systems and room to room transmission.
This is a question that goes back to schools that I wanted to get to. As COVID rates increase, it's from Nicole, as rates increase and teachers grow more uncomfortable teaching in person, how do schools determine whether to remain open during the surge or to close? Because we've focused a lot on kids, as we should, but what about that balancing those needs as well?
Yeah, I think schools can stay open even as community spread rises. My opinion, because the costs are so severe, is that schools should be the last things to close and the first to reopen if they did close. And right now, we're seeing really confusing messaging happening in many states where schools are closed, but bars, restaurants, casinos, massage parlors are open. Doesn't make sense to me. And so that's really problematic. And the other part of this is so we have data, by the way, that as schools stay open, as community spread rises, like for example in Europe, that the rates in the community and for teachers really match. So the data we have don't show schools as driving this level of transmission. Now, I've been really clear, it doesn't mean it should be schools as usual. Schools have to put in this layered defense risk reduction strategy: universal masking, hand washing, windows open, portable air cleaners, right? So they have to do this. And if we do these things, we know we can protect kids and teachers. And I think we also have to recognize that there's no zero risk in anything we do, outside the school, inside the school. I'm more worried about what happens outside the school. And to be honest, I'm in favor of things like having clubs and even after school sports, because what's happening now is that if we have hybrid models and after school, kids are seeking these other outlets, mixing with other kids, club teams, out of state competitions. And it's like, if they're together in the school, we're actually keeping everyone at a lower risk because their networks are actually smaller. And so when you have a hybrid model, what's happening? What is that kid doing on that day? The assumption, I think, faulty has been, well, if a kid's not at school, then they're home locked down, totally safe. And that's not happening at all.
That's an interesting way to think about kind of unintended consequences or the realities of policies. I
Yeah.
want to switch for a moment. So there's like, well, let's start with this one from, where did that question go? Um, oh, this question's from Susan. Air travel. We've just been through a time with a lot of record-breaking for the year air travel. Do you think ventilation in planes is adequate if people keep their masks on? Of course, there's the airport as well and getting to the airports. Tell us about ventilation and risks on planes.
Yeah, this is going to surprise people, and I wrote about this in May, that you don't get sick when you're on an airplane, really, and that's surprising because people say, "Well, when I travel, I know I get sick." But let's take away the airplane cabin environment versus what you mentioned, the whole travel experience, and it gets down to these fundamentals again: the environmental control system. So on an airplane, you get a 50-50 mix of outdoor air and recirculated air. So you get a high number of air changes per hour, 10 to 20 air changes per hour of coming in. All of the air recirculated on an airplane goes through a HEPA filter, which captures almost 100% of the particles that we're interested in. And then you have, you have the air being delivered at each seat. So for all these reasons, we don't see, it can happen. You can transmit this virus anywhere, but we don't see airplanes being places where we're seeing a lot of transmission. And in 2013, I wrote with others a report for the National Academies on infectious disease transmission in airports and on airplanes. And we had the same conclusion that this is, and based on decades of data, that airplanes are not places where people are getting sick. Now, just quickly, there are things that need to be fixed. In particular, and we called this out in 2013, and I don't know if it's happening. Airplanes, when they're at the gate, often don't have their ventilation systems running. So that time when you're boarding, I showed the CO2 concentration to start, 1,700 parts per million. We found over 2,000 parts per million on many airplanes during boarding because they're not running their ventilation system.
And what does that number mean? What do those numbers mean?
So that should be under 1,000 parts per million if you're getting enough air. So at 2,000 parts per million, that's telling you it's very underventilated. And so this is something, airplanes and airports need to manage the queues in security. The restaurants and airports are concerned. During the jetway, when it's tight and crowded, very little ventilation, and on the airplane, if the systems aren't running during boarding.
I want to ask, so this question comes from Valerie. This Sandy, my apologies. Sorry, Valerie. And it leads to a kind of theme of questions that have come in, which is I have been having my AC ducts fogged with Thymox. The technician suggests running the fan if I have any guests come over as added defense against COVID-19. How helpful is this kind of treatment and use of fan to circulate through a treated duct? And I also want to extend that to ask about, there's a lot of like disinfectants and a lot of like, advertising of different tools to help ventilate or increase or purify or disinfect. So this question's from Sandy, but I'm also wondering if you can expand to kind of how you suggest navigating a lot of the products being advertised.
Yeah, this is really challenging. And I've had vetted many of these over the past couple months. A lot has come on the market. And I'll just say it's a time to stick to the basics of what we're talking about here. If you noticed, I haven't talked about any fancy new technology. I'm not anti-technology. I like looking over these new things, but I've been careful not to, for good reason. You should avoid any of these misters, foggers. I saw the White House fogging. It just doesn't make sense to me. You're releasing a mist or a fog of cleaning chemicals. One, it's a respiratory hazard. And two, it's clearly not doing anything to disinfect the air, and of which ventilation do a much better job. And it's having little efficacy on cleaning on surfaces, which we know is also low risk for transmission. So a lot of this is being sold. We're over cleaning our surfaces. And if you want to clean a surface and disinfect, it's very easy with a rag and a common cleaner. Coronaviruses are really easy to kill on surfaces or inactivate on surfaces. So you want to avoid these misters, foggers. I wouldn't put a fogger or any kind of chemical treatment in a duct. I wouldn't have any device that emits these. If you're getting a portable air cleaner, just get one with a HEPA filter. Make sure it's not an ionizer or an ozone generator, any of these other things. No bells and whistles. It's a time for the basics. Open up your windows, better ventilation, portable air cleaner, better filters, and stay away from the push for some of these new unproven technologies.
What about humidity? So like dehumidifiers, there's a lot about how often viruses can travel better when it's cold. I'm conflating a few things there, but could you talk about that?
No, I think you're spot on, Alana. We can point people to another op-ed. I think it was 3 weeks ago. I wrote with other colleagues in the Washington Post about humidity. So we're talking a lot about ventilation, filtration, but there's one that doesn't get talked about much, and it becomes important as we head into winter when humidity gets lower. So really, a couple things are happening around humidity and the virus and transmission. The first is it's our own defense. So our respiratory system functions better when relative humidity is between 40 and 60%. And that's really about our first line of defense in our lungs. Our cells produce mucus, and they're ciliated cells, right? So they're constantly beating. So the mucus will capture particles in the air, including viral particles that in our lungs. The cilia will beat up, bring it up, and we swallow it harmlessly. Well, when it's colder or drier, I should say, we produce less mucus and the cilia function less well. We've seen new studies come out on this, just fascinating studies, watching cilia beat less at lower humidity. So that's one. The second is the virus survives better at lower humidity in the air. We don't quite know why, but it decays faster at that 40 to 60% relative humidity sweet spot. And the third one is the one you mentioned, that a drier air, as we talk and emit these larger droplets, well, they evaporate really quickly. And in drier air, that is sped up. So you actually get more of these smaller particles that then stay aloft longer. So in a couple different ways, humidity is influencing this. I do want to be clear, though, that the mechanisms for removal are faster from ventilation and filtration over humidity. It's also really hard to humidify a big building. But in your home, sure, you could have a portable humidifier for your bedroom or living room, and that can effectively bring up the humidity level into that sweet spot.
This question's from Deborah. Our schools don't have openable windows. What other suggestions do you have to stay safe? Realities.
Yeah, that's right. I mean, if it's a school that really doesn't have any operable windows, it should have another form of ventilation, right? So maybe you have ducted ventilation with a diffuser. If your school has natural ventilation, meaning the windows are the only source, well, then that's not right? That the windows aren't functional. And this is what I mean about some of these simple or relatively low cost fixes. I mean, it's inexcusable if that's the only form of ventilation and the windows are stuck closed, right? And that's an easy fix. It does point to what's been a gross underinvestment in our school buildings for decades, that we find ourselves in this position where we can't do even the basics in many of our school buildings. And by the way, these investments in the building go beyond disease avoidance and disease transmission. We know school students with better ventilation perform better on tests. So there's better cognitive function performance. These are investments we should have been making. And I hope that, as plexiglass goes away, that some of these other improvements, the ventilation system, stay.
So I want to move to some things that you did allude to before, but we've gotten some more questions coming in about this. So I want to ask these two questions sort of as one. One is from Alexi Cohen. If you are at a store, restaurant, or someone's home, how can you tell or know if the air might be filtered and not just recirculated? I know you mentioned that's difficult. And this question, another one from online, is I'm anticipating that my office may reopen in July. What specific measures should I be looking for when it comes to making sure that my building's as healthy as possible? As an employee, how can I verify these measures are actually working?
Yeah, these are really good questions. And I would encourage people to simply ask about this ventilation. What's happening at your work? What are they doing? And now, like I said, it's no longer you have to point to this scientist or that scientist. Point them to the CDC website. There's a page on ventilation. It lists everything that buildings should be doing, and ask, are we doing these things? Because you're not going to know otherwise. If you go to a friend's home, I would say mask on if they're not in your circle. Windows open, of course, you can see if that's happening, and you'll know if there's better filtration. If they have a portable air cleaner, it should be running. For example, my daughter had a friend over in our basement. Adults, we stayed away. We had all the windows open. I had 2 air purifiers going. We had 12 air changes per hour of clean air down there. I wouldn't have, and masked the whole time. So I'd say keep masks on, see if the windows are open, and see if they have a portable air cleaner.
This kind of leads into the final question, which is just how can I tell the difference between hygiene theater and strategies that actually work?
Yeah, so this is kind of why we wrote this piece today. If you read about it, we think the enhanced cleaning is hygiene theater. And to be fair, a lot of organizations, to the point about what's visible and not, you walk into a building, well, people have expectations. And if they see someone cleaning, it might feel good, right? But that's theater. Not that we shouldn't be cleaning, that's what we do our hands, but over cleaning everything, spraying misters and stuff, that's theater. It's not really leading to any kind of reduction in risk. So be aware of that. Be aware of gimmicky solutions. Hey, I have this new technology I put up in this brand new thing I put up in my ductwork. You just want the basics again. And so the gimmicks are gimmicks. And there's really little evidence behind many of them. So just look for these tried and true practices.
Okay, thank you for running a little over in this conversation. There's lots of questions, and I think this is a good time to wrap up. First, maybe to check the experiment. Remind us what the experiment started off with and what we can now check.
Sure. So we started at 1,700 parts per million of carbon dioxide, which baseline should be about 1,000. And actually around COVID times, you wanted 800. That was windows closed, doors closed. So just in the half hour we've been speaking, we're down at about 800, which is where I want it to be in this space. And to be clear, when it was at 1,700 parts per million, I would not have anyone over under those levels, and I would have a mask on. But that would tell me that it's a high risk for transmission. Now I'm pretty happy with my ventilation here. I would still have masks on and only have someone over if I really needed to. Better just to meet outdoors still. We see what's happening with the cases. The vaccine data look great, but those are eventual strategies. The right now strategies are still masking, hand washing, ventilation, and filtration.
Great. Well, thank you so much for your time and for joining this conversation. That concludes the discussion. Again, Joe Allen with Harvard's T.H. Chan School of Public Health. Thank you for your time.
Thanks, Alana. Always great to talk with you.
And this Q&A has been jointly presented by the Forum at Harvard's T.H. Chan School of Public Health and The World from PRX and GBH. You can view the full discussion on our Facebook pages and send feedback at Forum HSPH and at PRI The World. Join us again on December 15th, Tuesday at noon Eastern Time, for a discussion about the latest news on the pandemic and looking ahead with epidemiologist Michael Mina. Wanted to wish everybody a very happy and healthy holiday season.